Genital warts are small, fleshy growths on the skin and mucous membranes of the genital area. They can be uncomfortable and sometimes painful. Caused by the human papillomavirus, or HPV, a common sexually transmitted infection, they spread through skin-to-skin contact during sexual activity. These warts vary in appearance, making them sometimes difficult to identify. Some are small and flat, resembling cauliflower florets. Others are larger and raised, more noticeable and bothersome. Typically flesh-coloured or slightly darker, they blend with the surrounding skin. They can appear singularly or in clusters, sometimes merging to form larger areas. Not everyone with HPV will develop visible warts. Many carry the virus without signs. Often the immune system clears the infection before warts appear. Even without visible warts, an infected person can still transmit the virus. Early detection and management are essential to prevent complications and reduce the risk of spreading the virus. Consult a healthcare professional if you notice unusual growths for proper diagnosis and treatment options.
Genital warts are highly contagious and spread through skin-to-skin contact during sexual activity. This includes vaginal, anal, and oral sex. Even without visible warts, the virus can still be transmitted. The incubation period can vary greatly, taking weeks, months, or even years. This makes it challenging to determine when the infection occurred. Condoms may not fully protect against HPV transmission. Practice safe sex and communicate openly with your partner.
There are numerous types of HPV, categorized as either low risk or high risk based on their cancer-causing potential. Low-risk HPV types cause genital warts but not cancer. High-risk types can lead to cancer over time. These cancers affect the cervix, vulva, vagina, penis, anus, and throat.
Genital warts often present as small, flesh-colored bumps in the genital area. Their appearance can vary. Some warts may be flat, raised, or resemble cauliflower. Not everyone with HPV will develop visible warts. In women, warts can appear on the vulva, vagina, cervix, or anus. In men, they are found on the penis, scrotum, or anus. Seek medical advice if you notice unusual bumps or growths.
Diagnosis: what to expect. Diagnosing genital warts starts with a visual examination by a healthcare provider. They will ask about your medical history and sexual activity to understand your risk factors. Sometimes a visual examination is enough. They may use a magnifying tool. If unclear, further tests may be recommended for an accurate diagnosis. For women, a Pap test might be done to check for abnormal cells on the cervix. A colposcopy may also be performed for a closer inspection. A biopsy might be necessary to confirm the diagnosis. This is crucial if the warts are unusual or there's a concern about cancer. Early diagnosis and treatment are key to managing genital warts and preventing complications. If you have concerns or notice unusual symptoms, seek medical advice promptly. Over-the-counter treatment options. Over-the-counter treatments for genital warts are available and can be effective for some individuals. These treatments typically come in the form of creams or solutions that are applied directly to the warts. It's important to note that over-the-counter treatments are not a cure for HPV, but they can help to remove the warts. One commonly used treatment is Podophylox, which destroys wart tissue. Another option is imiquimod cream, which stimulates the immune system to fight the infection. Follow instructions carefully and consult a healthcare professional before use. Side effects like skin irritation can occur, but are usually mild. Consult a healthcare professional if warts do not respond to treatment or if you experience unusual symptoms. Prescription medications for genital warts. For more persistent or severe cases of genital warts, your doctor may prescribe stronger medications. These prescription options often work more quickly than over-the-counter treatments and may be more effective in clearing the warts. One common prescription medication is podophyllin, a resin applied by a healthcare professional directly to the warts. Another option is trichloroacetic acid, which chemically destroys the wart tissue. Both medications are typically applied in a clinical setting. In addition to topical treatments, your doctor might prescribe interferon injections. These injections are less common and typically reserved for cases where other treatments have been unsuccessful. Interferon works by boosting the body's immune response to fight the HPV infection. It's essential to discuss the potential benefits and side effects of each prescription medication with your doctor to determine the most appropriate treatment plan for your specific situation. Be sure to follow your doctor's instructions carefully and attend all follow-up appointments. Surgical options for genital warts. Surgical removal might be necessary in certain situations. If the warts are large, numerous, or causing discomfort, several surgical procedures can be used. Cryotherapy involves freezing the warts with liquid nitrogen, while electrocautery uses heat to burn them off. Surgical excision removes warts with a scalpel. Laser surgery vaporizes warts with a focused beam of light. Discuss the risks and benefits with your doctor.